My name is Lesley Onyon and I'm the Regional Advisor for Occupational and Environmental Health at the WHO Regional Office for Southeast Asia. So my responsibility is to provide technical support to the 11 countries that make up our region. WHO's role is the leading international agency for health, and as part of our role we have to routinely assess evidence for agents that are affecting health and monitor trends going on around the world. We provide support to the 194 member states that make up the WHO. So it's part of our role to routinely monitor and identify threats to health. So for many years now we've been monitoring the impact of air pollution on health, and we've been producing authoritative reports on the evidence of what types of health impacts are caused by air pollution, as well as the magnitude of those impacts. And we do that to help our member states to make their own decisions about how to handle the situation. So the fact that the air pollution is getting more and more attention, we're very happy that countries are taking note of the information and acting on the evidence that exists. There needs to be a change in preventive work. Air pollution is just one example of something that is going to add to the significant burden of non-communicable diseases that all countries are facing. So all countries, as they mature and the population gets older, they have increased amount of non-communicable diseases, and these are the things that also air pollution impacts on. Now, with air pollution, we have to identify the source of the pollution and prevent exposure. So we need to have much more action on the prevention side of things. Initiatives such as Swachh Bharat and other missions that the Indian government have can be enhanced to take on board air pollution as another risk to health. Smart cities, Swachh Bharat, the Prime Minister's Ujjwala scheme, they all can contribute to finding solutions for air pollution related health impacts. Well, many countries in the region are facing considerable challenges from air pollution, and we're concerned about this because of the way that air pollution affects the most vulnerable in our society, so the youngest members of society and the elderly. And often in the member states in Southeast Asia, they struggling to cope with many other diseases. They're still facing a burden of communicable diseases, as well as seeing an increased rise in non-communicable diseases. So the health system is stretched, and so the health system itself needs strengthening to be able to cope with this increased impact. But if we, as I said before, if we scale up the prevention, we can keep the numbers down. The biggest change is the increase in awareness of the problem, and WHO has certainly played a large role in that. But there's a lot more interest also at different levels of society, be it central government, state government, and at the individual level. So we see an increased awareness and an increased appetite for those different sections of society to come together, and that's absolutely essential if we're going to make any impact on the ground.